how's everybody doing? This is Dr. Andrew Torchio and
Dr. Brent Torchio from Pangea Chiropractic,
the two Torchio brothers here on today's podcast. We're going to take a little bit of a little detour from our normal podcast episodes, and we're going to talk about ankle sprains. The reason we thought it would be good to talk about ankle sprains and why we've even developed a protocol for ankle sprains is not really like, to give people necessarily the recovery portion of it, or like the physical therapeutic approach to an ankle sprain, but to expose anybody, not only athletes, but anybody, to the reality that, we're biased, but we get to see this every single week, that recovering and even preventing an ankle sprain really starts on a chiropractic table.
Yeah, 100%.
So how often do we see ankle sprains, Doc?
Quite often.
Quite often.
Yeah. Usually with athletes,
Usually.
but not always.
No.
Of course, ankle sprains can happen from missing a stair, stepping off a curb, but mostly it is in athletes. And the reality is, most people don't know that we can help them heal better.
That's actually the interesting part, because when we're in here treating patients, a lot of times in dialogue, patient will say, "Oh yeah, my daughter sprained her ankle," and then I look at them and I'm like, they need to come in here, and they're like, "What?" Because like you said, Brent, most people don't know that a chiropractor can adjust the ankle, and now we know that the research is actually supporting that. That's the best place to start.
Yeah, very first and best place.
And I'm going to share some more research as we go about how getting adjusted regularly actually prevents ankle sprains from happening, which this is a secret weapon for elite athletes. But the average weekend warrior or someone who's not at that elite level, they just have no concept of this. And those are the people that suffer the most.
Yeah.
Right?
Especially when you meet with someone, you start asking them about their overall health and anything that's happened in the past. It's pretty common that someone will tell you, "Oh yeah, I've sprained my ankle."
Or if you
ask them, they'll be like, "Yeah, multiple times." Or, "Oh yeah, I have sprained my ankle in the past."
And the sad thing from, just a higher level, the sad thing is that as we start to have more conversation with these folks, we start to realize that these are the people that maybe you listening, these are the people that give up the very thing that they love doing the most because of multiple ankle sprains.
Yep.
And I'm just like, oh my goodness, like that actually breaks my heart more than the fact that you sprained your ankle.
Right.
That you gave up running or soccer or pickleball because of ankle sprains. And it was like, wow, we actually can move the needle here for you. And and telling their chiropractor is like the least likely place that they would start. And then we find so much benefit and value for the patient when we start doing very specific chiropractic. And then like their mind just is blown. They're like, I never even thought to ask you. And in my head, I'm like, why not?
Yeah. But then once they know, they'll come in here 10 minutes after an ankle sprain. So you're the very first person I've got.
That's the coolest part. So let's talk about the mechanism of an ankle sprain, what types of ankle sprains we should be the first call or the first line of attack, which ones maybe we shouldn't. And we can talk about some of the recovery, the adjustment. We'll explain what's happening. I'll talk about the neurology and how the brain actually communicates with the ankle. And then from there, we'll just wrap it up.
Yeah.
We'll have some fun with this conversation.
Good.
So mechanisms of an ankle sprain. Let's talk about what's the major type of ankle sprain?
The major one is going to be an inversion sprain. So yes, when your foot or ankle rolls inwards. Of course, you can have a eversion ankle sprain, a little less common. Those ones are a little bit usually more traumatic.
I would agree, because the anatomy of the foot prevents the eversion sprain, just the way that the tibia comes down there and connects to how many ankle bones are there? Or
26.
26 bones in the foot.
26 bones in the foot.
So if you're someone listening to this and you're like, I never even thought to ask a chiropractor about this. There's more bones in your feet than your spine.
Exactly.
That is amazing. And we know how common spinal misalignments are. And we're spending all day on our feet.
Yeah.
So now like your mind should be blown if you're listening to be like, whoa.
Yeah, I mean, all of those joints and bones in your foot are what really governs your proprioception. So it's allowing your body to sense where it's at in space.
Mhm.
And every single one of those joints down there, you get input from your environment or the ground all the way back up to your brain, and then
Yeah, and this was the major push that happened, like a decade ago, and it still is very popular. The minimalists, the people that were really promoting barefoot walking, barefoot running, and then we saw the trend into minimalist shoes, which I'm actually a fan of. I wear Zeros.
Mhm.
They're a very minimalist shoe. You can feel and sense the ground under your foot. It mimics barefoot running, but it gives you a little bit of a barrier. And then you have the maximalists. The maxis are people that, well, what are those really thick?
the
Hokas.
Yeah.
Hokas. Then you have the maxis that they're like, no, you need to have, and there's good science behind both.
Yeah, really what it comes down to though is like those zero shoes you're talking about. That's designed to allow your arch to very subtly sense in space. While
Yeah.
those bigger shoes, those big high arch supports, I know Nike is thrown into the higher arch support.
Yeah.
Some feet just don't agree with them. Anyways, but that actually limits how your ankle moves in
Yeah,
that arch.
that camber or that flex of the arch. Okay, so an E version ankle sprain, you're probably not gonna find us because it's usually is really traumatic.
Yeah, those ligaments get pretty severely damaged during
Yeah.
those.
So 98% of the time we're dealing with an inversion sprain. What actually happens?
So in an inversion sprain, your ankle rolls in and it stresses the ligaments on the outside of your ankle. There's a big ligament down there. It's referred to as the deltoid ligament.
Yeah.
And that's the most common one to get injured. But really what happens when you sprain those ankles, those ligaments and tendons get stretched and pulled, and then boom, tons of inflammation.
Yeah.
Those are the telltale signs of, man, big swollen ankle, red, hot.
Yeah.
And then, following that time period, as your body's innately, intelligently trying to heal, it's sending inflammation down to that ankle.
Yeah.
But if that inflammation stays there long term, that can really prolong and delay the
That's
healing
the
process.
chronicity of what might seem like a simple ankle sprain. It gets swollen, and then if it's not dealt with correctly, which that's what we're going to do next, then the propensity or the likelihood that it continues to occur just goes up. And that's why most people who've had a really bad ankle sprain, grade 2 ankle sprain or so, they've always had 5 or 6 of them.
Oh yeah. Yeah.
Because those ligaments get stretched, inflammation shows up, the innate response, those ligaments don't get repaired properly, the bones get misaligned, and now this cycle just repeats, like, seems like forever.
Well, that's the thing, given the standard protocol, 6 to 8 weeks rest, will your ankle heal? Most likely, but is it going to heal properly?
That's the key.
That's the key right there.
Okay, so the ankle rolls inward, deltoid ligament gets stretched and sprained. Then what happens to the bones?
Usually, the two bones commonly that we find subluxated or misaligned following ankle sprain are your talus, which is your big top ankle bone.
Like right there on the top.
Right there. The calcaneus, which is your heel bone. And the calcaneus, when it moves properly, it should move like a windshield wiper.
Yeah.
Some of the checks we do to make sure your calcaneus is fairly mobile, it'll get stuck internally. And then your navicular, which is on the lateral side of your ankle, right in here. So it's really a complex of those three bones. And then even your cuboid, just depending on the anatomy of how that ankle rolled or inverted.
And even the general foot anatomy leading on it.
So those are the primary, I call them like the big four: your talus, calcaneus, navicular, and cuboid, which make up the complex of essentially the ankle joint.
And I think for the listener, or if you're watching, you have all these bones on the top of your foot. And if the ankle rolls in, what it does is it pre-stresses those joints, and it shifts them and almost blows them out like this. And then when it does that, then swelling comes in and it locks those bones in this flared out position as the foot, everything's here and it rolls in, it goes like that.
Yeah, and you can imagine those ligaments and tendons on the outside of your ankle. They're like a stretched rubber band with that integrity.
All right, so we have these misalignments of 3 to 4 bones typically. A lot of times people notice that, hey, the top of my foot is like really sore if I flex my foot back. These are the chronic people. If I bend my toes up to my knee, it's like I can't go as high on one side, or it's sore right where those laces meet. So almost, I mean, I don't know if I could say 100% of the time. I think I would argue it. If there's an inversion ankle sprain, those bones misalign.
Yeah, and usually that talus we were talking about, that big top one, usually if this does not heal properly, usually that talus bone, if this is your shin bone, that talus bone will stick up like this.
Yeah, you can feel it.
You can feel
I mean,
that's what's
we can
limiting.
feel it.
That's what's limiting the flexion and extension.
Yeah, that dorsiflexion.
Mm-hmm.
Okay. So now we understand what happens to the ligaments in the bones. Of course, then following is muscle instability up into the shin, to the tib anterior. Let's not go there. Now, if you have an ankle sprain and you get swelling way up into the shin, that might be an indicator that you need to go in and have some x-rays done.
Yeah.
But standard ankle sprain, grade 1, grade 2, where you get swelling just around the ankle is, I mean, that's like a home run for chiropractic.
Yeah, that's where we can really step in and help.
Okay. So I remember I did an interview with Dr. Craig Bueller. He was the very first chiropractor in the NBA. So he was hired by the Utah Jazz, and he helped take the Utah Jazz back in the 90s from the most injured team in the league to the injured team in the league in just one season.
Yeah, it's remarkable.
And when they interviewed him and they were asking him like, hey, how has your role contributed to this? He said, we're predicting injuries before they happen. And then the next year, half the NBA had a chiropractor on staff because of his work. And I remember researching, this is a decade ago, if an ankle sprain happens, the sooner you can get those bones adjusted, the shorter the recovery time.
Yep.
And that's really important for a listener, that if you are an athlete or you're just trying to stay active, if you sprain your ankle, the time to get that ankle looked at and adjusted is that day.
Yeah. Yeah, there's a window.
There's a window that maximizes recovery time. There's not a window in terms of getting it adjusted, but the recovery time significantly drops off or speeds up the faster you can get that thing adjusted and those bones put back. If you can beat the inflammatory response of the body, if you sprain your ankle, get it adjusted before the inflammation shows up, now you're really talking about expediting the recovery process.
I think Dr. Craig Bueller, when he was, really getting this work out into the world with those athletes, I mean, he was working on basketball players who sprained their ankle that game. He worked on their ankle, and then the next half, they actually were able to finish the game.
Yeah, it's really fascinating. And the key is and that's why if you watch football, every single football team has a team chiropractor. Every basketball NBA team has a chiropractor. These athletes, they're getting adjusted oftentimes 3-4 times a game. Where the average listener, you might be like, I've never even been to a chiropractor. Yeah. Okay. So adjusting the ankle is paramount for recovery. Or even if you've ever had an ankle sprain, you should just let us know next time you're in here. Hey, we checked my ankle, and a lot of times, boom, we find that misalignment. And it's one of my favorite adjustments to do on people, because they get off the table and take that first step. And I've had patients cry, literally tears of joy, 30 seconds after I've adjusted their ankle, because they stand up and they go, oh my goodness, I haven't felt like I'm walking normal for 20 years.
Yeah, I oftentimes hear it feels like they're floating, or they
walk out of a cloud. Yeah. So that's really, really amazing. Let's go into the next phase for recovery, because I got a lot to say on this, and I think you do too. Adjustment number 1. And a lot of times we'll have to adjust that ankle several times throughout a recovery process of, 3 to 6 weeks. Number 2, let's talk about RICE, because people have heard of the acronym RICE, which is rest, ice,
compression,
compress, elevate. Yep. Most people do the rest and a little bit of ice, and then most compression, where they put just a generic ankle brace on that you get from Walgreens
or a boot.
So rest is obvious. Okay, ice. I tell folks, I'm more interested. I think you probably tell them the same. If you sprain your ankle, you should be doing ice baths. Yeah, not like peas on the foot. I tell people, fill up a bowl or a bucket of ice, then fill it up with water and completely submerge your foot in there for 15 minutes.
Yeah, I tell them the same thing.
Take it out, wait 20 minutes, wait an hour, do it again. So I tell people that have a significant ankle sprain, you need to do that like 5 times a day. Ice bath on the ankle, at least for the first couple of days, and then you can start branching out to once a day or twice a day.
Yeah, why is that ice so important? What is that actually doing?
Well, the ice prevents a hyper exaggeratory or hyper exaggerated inflammatory response. So blood flow is good. The innate intelligence says when there's an injury, send blood because blood brings nutrients of
Mm,
healing. Okay, if those bones are misaligned, you want to get those bones adjusted before the maximum amount of inflammation shows up. So we're just trying to minimize that inflammatory response so that as you're getting adjusted, yes, you're still going to get blood flow down there, but as you're getting adjusted, putting the bones back in the right spot so that when the inflammation shows up, it doesn't lock those bones in the wrong place and then keep those ligaments in this stretched, like rubber band state. Because then the longer they stay stretched out, the harder the recovery is
mhm.
of that deltoid ligament. Any thoughts from you on that?
Yeah, I just think it's a critical piece to the puzzle.
Yeah, it helps. It's nociception, so it helps minimize pain. It helps decrease that over the top inflammatory response. And when coupled with adjustments,
Mhm.
the adjustment and the ice is just like that's the ticket.
Yeah, that blood can also pool up in your soft tissue too. Not, physically pool up, but
A
essentially
little bit.
a little bit. But the longer, like you said, that inflammation, more blood flow. Those are the folks after an ankle sprain. When you start to really work up their shin, it
Oh yeah,
hurts.
yeah,
And that's what that's from is the stagnicity of that blood flow happening.
yeah. That's good. It creates a pumping mechanism too. So you do 20 minutes on, 20 minutes off, or 15 minutes on, 40 minutes off. You're getting the ice, then you're taking it off, and it's pumping that blood flow. So it starts to move that blood flow, which the next piece is the compress or the elevate.
Hmm.
The elevate does the same thing. It starts to drain some of that inflammation back out. You just want to keep the circulatory system moving,
Yeah.
lymphatic system, as well as the blood. Just want to keep it pumping in and out, in and out.
Hmm.
You don't want it to get stagnant. So compress is the next one. So um, I have kind of you know, a different perception on this. I tell people only compress with a brace if you absolutely need it. You might go through just a week of an ankle brace. We don't do taping here at
Hmm.
Pangea. Taping can be beneficial if you know how. Um, but getting some compression on there in between the icing cycles can be a good thing
Hmm.
too. The reason I tell people not to get in the habit of chronically wearing an ankle brace is because that changes the neurology of
Yeah.
the whole foot, and the biomechanics of it.
Yeah.
Because if you're always putting it on, you're turning off certain muscle groups. And the more you turn off a muscle group, then when you don't have it on, when you're just going for a walk down the block and you hit a twig, now your body's not used to firing and supporting those muscles. And then the likelihood
Hmm.
of a reoccurring ankle sprain actually goes up by chronically wearing a brace.
Yeah. Especially too with those big, heavy, those boots.
Yeah.
If you haven't had your ankle adjusted, following an ankle sprain, that can create a lot of compensation. A lot of times those boots are really thick and big, and I mean, if you just watch someone walk with a boot support on,
It just looks
yeah,
painful.
it looks painful. Yeah.
Yeah, they're not designed for ergonomics of the spine, pelvis, foot, and ankle. They're designed to
Yeah,
stabilize.
stabilize.
So you kind of, you know, good and bad.
Mhm,
Okay.
mhm.
So the next one is elevate, especially in those early stages, especially at the end of the day. You just got to get your foot up above heart. So lie down, get your foot up on some pillows, and keep that thing elevated in between icing cycles.
Yep.
Okay. Next thing that we do, that especially for our acute ankle sprains, is laser.
Mhm.
So let's talk about that for a second.
Yeah, super powerful tool.
A super powerful tool. The word kind of scares people. It's not like a burning laser,
No.
but um, we do use laser protocols for ankle
Yeah.
sprains. Um, some insight from me is certain frequencies of light, specifically the frequencies that we use, we shine that bright light on the area of injury as well as on the spine where the nerve roots come from that coordinate movement and neurological function of the foot. We treat those two areas in conjunction. On the injury site, that light, infrared light and red light at a certain frequency, the red light actually is called uh,
Photobiotics.
photobiomodulation. That's a mouthful. Okay, and what that does is it stimulates the cells for repair and recovery. So that frequency of light stimulates mitochondria, which is a tiny part, back to high school biology for most people. A tiny part of the cell is the powerhouse of the cell. And that light triggers that and it turns it on to start replicating and repairing. Okay. It also, and then we have the infrared light. The infrared light helps with inflammation, and helps the pain response. So we use those two frequencies of light. Treatment protocol would be just 7 minutes. Just lie there and shine the bright light on your foot. So we've found that to be extremely beneficial in expediting the recovery process.
Yeah.
Okay. Home care. So after we get someone through, the first couple of weeks and they're moving well and starting to feel like themselves again, home care is all around balance.
Yeah.
We oftentimes don't ever have to refer out for any specific rehabilitation. We do that if needed because we don't do specific rehab at Pangea. But just really basic stuff. Like we got to get those muscles firing better. And just really simple for this conversation, I tell people standing on one foot and focusing on hitting 3 points of the bottom of the foot. So point 1, point 2, and point 3. Stand on one foot with a 5-degree bent knee and just hold and stabilize and stand on that one foot. And the goal is to get up to 60 seconds or longer.
Yeah, without wobbling around
Just
too much.
Creating stability back in that joint. So that's, people always ask, what about the home care? And I say, well, we got to get there first. But the majority of the time with following this protocol, I mean, people are good to go.
The other one I usually recommend too is just if you are wearing a boot or a brace, just pull that brace off throughout the day and just spell the ABCs out.
Yeah.
Your ankle. Just get it moving.
Do a little cursive ABCs just to keep that thing moving. That's really good. Okay, so now just some updated research. One of the things that I know to be true and why so many pro athletes are using chiropractic regularly is because research has now come out saying that regular spinal care increases cortical drive of the body, the nervous system. And what that means for a listener is that when you're regularly adjusted, the transmission from brain signal down to the foot goes up. And the studies that they did were measuring that nerve impulse from the brain to the foot. And the studies indicate that one chiropractic adjustment increases cortical drive. So what that means for you as a listener is that when you're regularly adjusted and don't have subluxation, the speed of transmission from the impulse from your brain to whatever body part we're dealing with, that speed happens faster, which increases flexibility, increases strength, and increases agility. Reaction time. So from my perspective, well-adjusted people don't get ankle sprains as much because before their ankle all the way inverts, the body self-corrects through this neurological response or reflex in the body. And you know this if you're a hiker or a walker. You could sprain your ankle 1,000 times, but you kind of hit something and you go, whoa. Someone who's subluxated and has misalignments in their pelvis and especially in their spine, that time goes down, that response time. And when we're talking about an ankle sprain, we're talking about milliseconds. Why can I self-correct faster than you? And the answer is if I'm well adjusted, we absolutely can because the science has indicated that.
I was hiking with my friends recently and I had something like that happen. We were on some rocky terrain and it happened a couple times where I would do that and self-correct and my friends were like, wow, what's going on there? So I'm well adjusted. I said, what?
They don't even know what that means.
They don't even know what that means. But that's your body's brain-body connection firing rapidly.
And then the second study that's available to everyone just on the internet is of Taekwondo athletes. High-level Taekwondo athletes, same type of study. They were they were tested for muscle strength in the foot. So muscle strength to do, was it plantar? No, dorsiflexion and plantar flexion of the foot. One adjustment, they showed a 9% increase in flexion strength. One adjustment.
Man, that's so cool.
So that's another perk of being well adjusted is increased muscle strength. That's why so many athletes use chiropractic.
It's so good when you can, see the amazing things and then put some study or research
Yeah.
behind it just to better equip yourself to live better, be better, and get stronger and decrease these
That's right.
sprains.
So we went through a lot of information there. If you're listening and you're like, oh my goodness, I've never even considered going to a chiropractor, let alone for an ankle sprain, we're here to let you know that we're here for you. All the doctors at Pangea are trained to do proper ankle and foot adjustments. And on top of that, we covered just the recipe for success if you've dealt with an ankle sprain in the past. So that about wraps it up. If you're listening and you're enjoying the Pangea Health podcast, give us a thumbs up, like it, and subscribe because we're dropping episodes 2 times a month. And we got the whole year planned out for you where we're going to be breaking down all of the updated Pangea protocols. So as a listener, you could become an expert in health and wellness just by listening to this podcast twice a month.
Yep.
So
you have access to us. Use it, share it, and we're here for you.
Awesome. We'll see you in the next episode.